Today, we're tackling the topic of plantar fasciitis, and we've got Brenton from Hurst Podiatry with us. He's our Starts at 60 expert in all things feet or podiatry world. So, Brenton, welcome. I guess first up, what is plantar fasciitis, and how do you know if that's what you have or whether you have something else wrong with your feet?
Yeah, thanks for having me, Wendy. So plantar fasciitis is very common. Doesn't roll off the tongue very easily. A lot of people have trouble just saying it. So the plantar fascia, we'll go back a step. The plantar fascia is a collagen structure that sits quite close to the surface of the foot. It's very commonly injured, but it's also probably quite overdiagnosed. That we tend to talk in terms of heel pain, not so much plantar fasciitis. Plantar fasciitis is a bit of a mislabel. The fascia that actually gets injured actually wants for much blood supply, so it doesn't really get inflamed, which the itis in the term describes. So very commonly, it's actually aggravation of that connective tissue under the sole of the foot, but it can also be different tendons that attach around that area, compression of different nerves. But if we're talking a true plantar fasciitis, it's an aggravation of the surface of the plantar fascia itself, which is a collagen structure that runs from the heel bone up to the ball of the foot. So it's an aggravation of that area.
Okay, so now I've learned that I wasn't quite saying it correctly. I'll probably avoid saying it from now on, but that's okay. So do you usually get it in both feet, or if you're going to get it, or do you get it in, is it usually found in one foot at a time?
So most of the time it will present in one foot at a time. I think the literature, depends on what you look at, but about 30% of cases will present with both feet being sore. But most of the time it's one foot. Typically what will happen if you end up with a second foot, it's normally not quite as severe, and it normally comes on subsequent, because if you've got a really sore heel, you will walk differently and you'll favor a different portion of your foot. And that, often the feet are reasonably similar, pretty symmetrical. So if one foot's got a vulnerability to that condition, the other foot's probably not much better off, and we can end up with some symptoms on the other side. But most cases you'll see it on one side. Normally when it's both feet, it's normally because someone's neglected it for a long period of time and it's ended up in the second foot several months later.
Okay, that makes sense. So the first message is don't ignore it if you're starting to feel foot pain. It does sound quite, it does sound quite painful, obviously, in the foot itself. But does it also, cause that kind of what I would think of as referred pain, like do you end up with back pain because you're favoring one foot or the other or anything like that?
Yeah, absolutely can. It's quite common. Imagine if you've got a really bruised heel, because that's one of the main ways that it's described. The thing you'll try and do is to not walk on that part of the heel. So you might end up walking on the ball of the foot. That can create issues down there. You might walk on the outside of your foot, and getting on the outside portion can tip your weight out. That can stir up knees, hips, backs, ankles, all sorts of things. The longer we've got it and the more time we spend compensating for it, the more likely we end up with injuries either to the other side of the body, other parts of the foot, or any part of basically the back down. Just through trying to avoid the thing that hurts.
Yeah. So how common is it? Do you treat this sort of every day? And I guess at the same time also, like, what causes it?
Yeah, so exceedingly common. It's the most common injury of the foot and ankle for that matter, apart from maybe an ankle sprain, depending on what literature you look at. We have cases of this walk into our clinic all the time. It is often, as I say, more a heel pain issue. Plantar fascia could be a component of it. There's often a few layers to what's happening there. And I guess that's the skill of the clinician, is to get in there and give you that diagnosis and then create a management plan that allows for all of those things that are injured, not just the plantar fascia. So yeah, some of those other symptoms, we can get nerve compressions that can result in that really sharp shooting sort of electrical pain. Often what will come in, people will describe a multitude of different symptoms, and that's normally because different tissue structures are damaged. So nerve will hurt in a certain way, a bruised bone will hurt a certain way, a torn ligament will hurt a certain way, and we'll get a mixture of those symptoms and feelings, and that'll be the combination of things that people are reporting and feeling. And that's why sometimes, the classic plantar fasciitis symptom is that step out of bed, first thing in the morning, foot's really sore because all the soft tissues stiffened up and there's not much blood flowing through the area because we've just gone to bed for a long period of time. That's your really classic plantar fascial symptoms, but some of those other things that can go wrong can create alternate symptoms as well.
Awesome. And What sort of shoes, like, can you wear? Is there some sort of shoe that is more forgiving for it? You know, when someone comes and sees you and has this condition, is there something that you recommend that they start to do in terms of, you know, what they wear on their feet?
Yeah, absolutely, there is. Again, it comes back a little bit to exactly what's wrong, and it is a bit horses for courses. You know, it depends on what activities they're trying to do, you know, obviously. But if you're talking just a generic shoe to get around in, a runner, just a walking shoe that's been fitted professionally by a high quality footwear store, most areas have someone that does that really well, is probably the best thing, because it offers a combination of being fairly lightweight, supportive, normally has some arch support, which can often be a critical component with this particular condition. And that's probably the best thing as a generic starting point. There's probably almost more about what to avoid than what to wear. So you really, I'm going to throw a couple of brands under a bus here, but your Dunlop Volleys and things like that, those really unsupportive shoes that you can literally like tie in a knot. They're not ideal. Constant use of Havaiana sort of style, just flat
ones. Yeah, right.
Yeah, they'll stir it up. We see this all the time walking to the clinic around February, March, because people have had a few months with the warmer weather wearing unideal footwear, and the foot's been unsupported for an extended period of time.
Right.
So,
okay.
So getting back to the generic sort of, you know, good quality runner is probably the soundest thing to do, especially for your high volume activities. I say to my patients all the time, footwear's a bit like your diet. You can cheat on it a little bit around the edges, but if you're doing the wrong thing too often, you're going to end up with problems. So, yeah, if you're off to the shops, you'd be surprised how many kilometers you walk just, you know, trudging up and down your average big shopping center. So you need to have the right shoes on for those sort of activities.
Absolutely. Absolutely. I think you do underestimate, you know, when you go to a big shopping center, especially you just, you know, chuck on some flip flops to go and do something. You know I certainly do notice the difference between, you know, what my feet feel like when I get home, you know, if I have done that kind of, instead of wearing something that is definitely more supportive.
Yeah. I think the advent of the smartwatches too really makes us a bit more aware of just how many steps we're doing, and they rack up really quickly. And you can sort of think, oh, I'm just going to chuck on, just running to the shops, I'll chuck on this, you know, pretty ordinary pair of shoes because they go on nice and quick. And before you know it, you've done 3,000 or 4,000 steps, and it can do a fair bit of damage in a short period of time.
Absolutely. So what sort of treatment, you know, obviously the best thing to do is if you've got this kind of heel pain, is to go to a podiatrist and seek assistance. And, you know, obviously there's treatments that you can do. What kind of treatments do you do? And I guess people are going to want to know, does it hurt more? You know, does the treatment hurt, you know?
It depends on the treatment, I suppose. But one thing I will emphasize with that is it's so much easier to address this condition if it's caught early. The patients that walk in and I've had a sore heel for like a year or two, so difficult to get that right versus the ones that, you know, have been a bit more responsive to it. So that's probably the first thing. The next step, once you physically come to the clinic, is to work out which of those different pathologies do we have. Is it plantar fasciitis? Is it a nerve entrapment? Is it some of the other things that can go wrong? And then kind of tailor the treatment plan based on what it is, but also the goals of the patient. If you're trying to get someone back to playing high-level football, that's a pretty different recovery process to someone who wants to walk the dog around the block a few times. So treatment options, some of them are painful, some of them are not, and some clinics have certain skill sets and some don't. But you can look at things like orthotics and footwear changes. They're typically not painful. Exercises, stretching of the arch and the calf muscles can be really productive for this one. So no pain with that one, or very little. You can use things like topical anti-inflammatories. So it can be like your Voltarens, physio creams, those sort of things are great. Bit of heat or ice, depending on, it's a bit of a controversy over whether you use heat or ice. I won't dive too deep into that. But
I think that's a whole other conversation another time.
Podcast potentially. But and then you've got some more sort of medically driven treatment. So that might include shockwave therapy, which certainly can be uncomfortable. Cortisone injections, ideally where the foot's numbed first, because heel injections are they're like a 12 out of 10 for pain. They're not very pleasant. But you can numb the foot if you've got the skill set for that. Laser treatment is something we do quite a lot in my clinic as well. That's quite painless and can work really well. Braces, moon boots to offload. There's so many things, and it just depends on where you sit in terms of that continuum of pain. So, and how long have you had it? How severe is it? What is it? And then the job of us as a podiatrist is basically to work out where you are with that and give you some treatment options and the pros and cons, and we fit that around what the person needs. So heaps of options.
Great to hear there's heaps of options, because I did hear that word pain quite a fair bit through, through the conversation today. So my last question, I guess, is, can the Starts at 60 audience do anything, as part of their day-to-day routine to avoid getting, and I'll try and say the word correctly this time, plantar fasciitis. No, I can't even say it. What can they do to avoid it?
So yeah, you can definitely get out in front of this one. Some people are more prone to it through foot type and the way that they walk, but wearing good quality shoes, like we touched on, is probably the single best thing that you can do. Being sensible about the type and volume of exercise. It's great to get out there and get active, but don't start off by trying to run marathons. Build up sensibly to these sort of things. Mix your exercise around too. You use a combination of non-weight bearing stuff like swimming, Pilates, cycling, that sort of stuff. It's great, not just for avoiding this, but that's like reducing the impact and spreading the love around the body more universally. And as I said earlier, probably calf stretches and arch stretches are a pretty easy one to tack into sort of whatever other exercise regime you've got. We know there's a pretty strong link between tight calf muscles, pulling the heel off the ground early and triggering a bit of plantar fasciitis. So that's another one you can get out in front of as well.
Okay, fantastic. Thank you so much for your time today. I think the message is, if you have heel pain, go and see a podiatrist, because obviously there's so many things to do in terms of catching it before it gets too severe, but also treating it, but also learning what you can do from a day-to-day perspective to make sure it doesn't get worse or that you don't get it at all. So thank you for your time today, Brenton.
Pleasure. Thanks for having me, Wendy.